Hi, Liz. Hi, Martha. Thank you for joining me. Hi, Live. Hi, Bestie. Oh, hi. Hi, Bestie. Hi, April. Oh, I'm so glad you caught alive too. So this is my once a month live. Y'all were due for a once a month live. I had been doing lives a couple of times earlier this month, only because just didn't have time to film. So I thought I would do the once a month live official today. Um, as you all know, this is the time of the month to come on and ask your questions, whatever you like. Try to avoid the really basic questions because I have so many videos on my channel about that. But anything you guys want to talk about, I really want to talk about setting career goals and what you want to do once you either finish the school or once you start to go out there and look for your job or once you're in your job as a coder. Where do you go from there? How do you keep your skills up to date? How do you keep them, you know, growing, and how do you keep learning? So that's the thing I'm going to be talking about tonight. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder, and we have a lot of people already. Okay, good. Let's see. Asking for a friend. Cute. Yes, yay. Okay, so setting career goals. So sometimes when we think about the goals that we want to set for ourselves career wise, sometimes they can be big, sometimes they can be small. I really do recommend having at least three small goals that are going to get you to your big goal. So if you have one big goal, which is, let's just say you want to be a coder. Okay. So what are your three small goals? Well, obviously one of these small goals, it's not really a small goal, it's a big goal, but it's to get certified. So if you're studying right now, that's going to be one of your small goals to get you to your role as a coder. The other thing is setting a small goal for listening to the guidelines or reading the coding guidelines, because having that knowledge is going to set you ahead of the pack when it comes to interviewing and getting these questions from these employers, because they will ask you questions about the guidelines, and they don't expect you to memorize them, but they expect you to kind of know whereabouts and how to find them. You don't want to sit there like a deer in the headlights looking and being like, well, I don't really know, or I can't recall. You want to make sure that you say, okay, well, I do know this about this, this, and this. Okay. So even if you get stuck and you don't remember something, at least they know that you've reviewed the guidelines enough that you have that sort of knowledge base already. So that's something that you could also set for yourself. The other thing, the other small goal is, if you feel like you are a shy person when you're out there interviewing, and that's something that you need to set a goal for, which is to get more comfortable with public speaking and with speaking with others. I know that sometimes it's really difficult, especially in the culture that we live in now, where everything is, by text message, and no one calls each other on the phone anymore. Apparently, that's an old thing to do. I still like to call on the phone. I don't call all the time, all these people. I'm very selective about who I call. I talk on a regular basis with my Uncle Kyle, who I adore, and we always catch up, and he gives me really good life advice. So that works for me, and it's nice to have that connection with somebody on the phone. I'm not a really big texter. I don't really like to do that because to me there's no inflection in the voice. But for some and for most people I know, that's their preferred method of communication. But like I say, there's no inflection in text messages. There's no voice, and sometimes people misinterpret what you write. And even if you write with really good grammar, which I do, apparently, if you put a period at the end of a sentence, it's aggressive. Okay, so that's something that I don't know, it's just a generational thing that's different. um, all right, Dorothy says, "Hi, Blue. If you remember a while ago, I took the medical billing and coding for another certification. Well, for the yikes being that's on the back burner until I get the right certification. Good. Hi, hi, Kane. I wish people my age talk more on the phone. I think I'm secretly old. Sometimes we just have that. We just have that. That old soul. And that's okay. There's nothing wrong with that. When I was younger, and like 10, 12 years old, I started listening to Elvis. And I'd always listen to the oldies, and everybody's like, "That's so old, and why would you listen to that?" And I love Elvis, and so I still love Elvis. I have pictures and posters of Elvis all over my office. So, and everybody knows in the hospital that I work at that I love Elvis. And so, but it's just something that's, I don't know. It's the more mature side of me, I guess. Um, Dorothy says, "Good news. I just landed a remote work job. Good. As a scheduler. Oh, okay. Well, that's still good. If that's where you want to start at, good. Make sure that you keep studying for your coding exam though, okay? Whichever one you decide to take. Hi, Alexandria. Hi, Letty. Doing great. So, like I said, setting these small goals of being more comfortable with speaking, and sometimes that comfort of speaking is going to really help you during this time when you're getting all these interviews, because when you're interviewing and you are very nervous and you say, "Well, I'm not used to doing all this talking with people and things like that," that's something you got to get yourself out of, because getting into coding is going to require you to do some speaking. Okay, you have to get out of that shyness, because as my Uncle Kyle says, a closed mouth does not get fed. You have to know how to speak and to be able to share the things that you know and the skills that you have. So that's the thing that I would set if I was setting a career goal to get to being a medical coder. Now, when you are a medical coder and you've been in the field for a while, you've been in for 2 years, and you have been working in one specific specialty, say you've been working in the ER, the ER has exposed you to a lot of different specialties. Of course, ortho with all the accidents, and cardio with chest pain and heart attacks and things like that. And so neuro, any strokes that come in. So these are things that you can spend this time, if you start off in the ER or any other place that's going to expose you to a lot of different coding specialties, like the ER or family practice or urgent care. These are places that are going to give you that exposure to a lot of different things, not just a certain specialty like respiratory or urology or any of those things. It's going to give you a good variety of specialties to look at. So when you're in and you've been in for 2 years, you can set your career goal of, okay, I want to expand my horizons. I would really like to work in ortho. And so that's when you start seeking out those opportunities. And whether you let that be known with your employer that you would like to be cross-trained into a different specialty, or whether you start to apply for other jobs if you're willing to move on from that position, you never know. And you always want to give yourself the opportunity to be able to expand your knowledge, and I don't want to say don't be loyal, because loyalty is a great quality. However, if that loyalty impacts you from growing as a professional, then it's not good. But if you are staying at that place for years and years, and there's some benefit to it, whether it is really good pay already, or you're getting steady increases in your pay, you're getting really good benefits as far as like your education. Some employers and some hospitals will pay. It will help pay for your degree. So if you decide at that 2 years to say, okay, I would really like to move over and learn other ones. I want to be cross-trained so that I can help. If somebody has to go on leave, we're not stranded and left as a department without, some help and some backup. And so that's going to make you look really good too. And if they're not willing to train you, that's okay. You have 2 years of experience. Now you can go anywhere and you can start to apply and get your resume together and have better opportunities. Because sometimes it's not always the case. Um, Leaders and really good leaders, very supportive leaders, are sometimes very hard to find because more often than not, sometimes people in leadership, they're good for certain things, but not all things. And sometimes they can stop a coder from growing, unfortunately. And so that's why I always, when I'm on here and I'm telling y'all, y'all got to toughen up, y'all got to do this, y'all got to do that. Because sometimes people will get so set into, okay, this is what my supervisor said. And my supervisor told me, oh, don't go anywhere and it's not worth it and blah, blah, blah. And they end up listening to them because that supervisor does not want to lose that coder because they're good or they're reliable or they're consistent. So whatever it is, you want to make sure that you know for you that you have the ability to go anywhere and to be able to do anything. So that's why I say you have to toughen up and be strong, be a strong person. And so, like I said, if that employer is helping you to say, okay, well, we want you in this clinic right now, but we don't have time to cross train anybody. That's okay. You can practice on your own. Or if they say, well, we do have money if you want to get your degree, that's you taking advantage of that money that's there. And sometimes if you do take advantage of that money that's there, they'll help you to pay for your degree, whether it is for the associate's degree or the bachelor's degree in health information. You want to go with either one of these, and you may have to like sign an agreement that you'll be there, like you'll have to work there for a certain number of years, but it's worth it, right? Because then you avoid huge student loan debt. Because as I've said, I do not believe in student loan debt. I don't think that people are being creative enough to know that there's a bunch of resources out there. And I don't think that it's right that young people are fresh out of high school and really don't want to go to college, and they're being forced because everybody's telling them, oh, you need to get a degree in order to be successful in your working life. That's not true. To be a coder, you don't have to have a degree. And you could be very successful. And as I've said in the past, anytime that I've worked with others who have had the RHIT or the RHIA, I've made more money than them just having a CCA. And why is that? Because a person who's working as a coder with a degree, and some of you may not agree with me, and that's totally fine, but what I'm saying is this: those degrees are for our leaders. If you are a leader working as a coder, you are working under your potential. So that's what I tell you guys, that make sure that when you're getting into this, don't get a degree unless you want to be in leadership. If you don't want to be in leadership, then you need to concentrate and focus on, okay, well, I have the CCS, the gold standard of medical coding credentials, because it says you've mastered inpatient and outpatient coding. But if you say, okay, well, I've done that certification, now let me do this CDIP, right? And that's for clinical documentation integrity. Now, if you've been in for 2 years, you still need a little bit more time, but maybe if you've come from a background of medical, maybe you come in being a nurse, and you've gone over to the coding side, and now you want to get into CDI, clinical documentation integrity, and you want to sit for that credential, that would be good because you've had the time in, you understand the fundamentals of coding, and you can use your nursing background because CDI involves improving the documentation. So you're working with providers and you're being an educator. And basically, a CDI is going to be the liaison between the coder and the provider. This is why I say my nurses that are just trying to come in off the street and just going straight into CDI and they think that they don't need to do coding. No. You still need to understand what it is and the fundamentals. Because if you don't, well, guess what? Then you think that you need to side with the doctor immediately. Well, we know as coders, the doctors are not designed to be coders. That they're designed to take care of the patients. That's why we have jobs to make sure that their documentation is straight. So these coders will talk with the nurse to talk to the provider. Hey, these are our concerns, and the provider's not doing this. Maybe he'll listen to you or she'll listen to you. And if that nurse, the buck stops with her or him, and they say, okay, well, the nurse CDI is like, no, this isn't important, but then you don't know about coding, well, guess what? You just slammed the door in the coder's face. And so, how is that provider ever supposed to get better documentation because you thought you knew? And you can't put your ego aside to say, I can listen to this person who has a certification, who has experience. I can listen to them. Okay, that's me as a nurse CDI, right? If I'm a nurse CDI, putting my ego aside and saying, okay, well, they're correct. Let me go ahead and talk with this provider about this. Because the way that it is when a provider has a coder nurse in front of them, or they have the coder who's had years of experience, that doctor is always going to look at that nurse coder first. Just because there's that built-in relationship between coder and not coder, but between nurse and doctor. But if that doctor has already been around a bunch of good coders who have experience and who are not nurses like me, then they know, hey, where there's a difference here. There's a difference in somebody that, even though they have experience and no nursing degree, they may know more about this subject than somebody who is a nurse. So setting those types of goals where you can have something to strive towards is going to help you, and it's going to prevent you from getting into like, oh, I've been a medical coder for 5 years and I've always done the same thing. I think as coders, we need to set those goalposts and constantly move them up. If you're that coder that wants to turn CDI in 2 years and you say, okay, well, I got a nursing background, I think I'll be okay. And if you don't have that yet, if you don't have a nursing background, that's okay. If you say at 2 years, I would really like to go into CDI, I want to do something in education, then that's when you start self-studying for all of the other things. So in 2014, when I had my aha moment, when I finally figured it out that this was not a job, that this was in fact a career, what I did was I started reading the New England Journal of Medicine. Well, of course, it's the New England Journal of Medicine. These are doctors talking to other doctors, and they don't have to break things down like they would to somebody who is a civilian, right? Who is not a doctor, and they have to explain things in a different way. When doctors are free to talk to other doctors in their language, then they speak a lot more freely. Well, me coming in from the outside as a coder and being able to be basically a fly on the wall reading the New England Journal of Medicine, I'm like, okay, this word doesn't make sense. Let me look this up. Oh, okay. Let me look this up. Oh, okay. This makes sense. Well, guess what happened when I started doing that? Suddenly, surgeries started making more sense to me. When I hear the doctors talking in the hallway about this and this and this and this procedure and this and the third, it started to make sense, and I understood what they were saying because I was reading. And even though it's a little intimidating at first, because like, oh my gosh, but it got easier. And then I got so excited because of course I'm a nerd, and and so I would be like, okay, I got this. I can figure this out. And some things I would just be patient and listen. And sometimes I was building really good relationships with my providers, and I was able to ask them questions. So that helps. And again, that builds your knowledge. And so, like I said before, there will be a time in my career where things will change, but it's all of this experience that I've been building over time that's going to help me and propel me forward. So that's what you want to do when you're setting these goals. It's just my advice anyway. All right, what did I miss here? All right. Misty says, hi, Blue. My coding books arrived yesterday. I'm excited. I'm excited for you too. Bestie says, Miss B, I need to catch up on your videos, but my questions are, do you recommend the AAPC or traditional college? Starting as a medical coder, should we take the CPC or the CPC plus billing? So all you need is a CPC. I do not, me personally, my own opinion, just so everybody could put their pitchforks down. My personal opinion, if you're asking me, when it comes to selecting between the CPC and the CPC plus CPB, I will always recommend the CPC only. You just need one credential. The CPC also tests you on reimbursement, which is your billing side. Now, billing, it's going to be okay, it's all more of those, things. But when they're looking for coders, they are asking for 4 credentials. You just need one. The CCS, which is the gold standard of medical coding credentials, the CCA, the Certified Coding Associate, the CCSP, the Certified Coding Specialist Physician Based. These are all with the American Health Information Management Association. The CPC is a flagship credential for the American Academy of Professional Coders, and this says that you know outpatient coding. The thing that's different between the two associations is that with AAPC, they are a for-profit organization. If you have a CPC and you do not have any experience in coding, you will carry an apprentice status for 2 years. That apprentice status, you'll be a CPCA, right? The apprentice status just says you have less than 2 years of experience. You can accelerate the removal of that apprentice designation by buying their programs like PractiCode or going through one of their approved programs for schooling. So if you do that, then you're able to accelerate the removal once you complete everything, and then you'll be a full-fledged CPC in less than 2 years. Now, if you do that, you are still being looked at by the employers as, okay, then this person should know, even though you don't have experience yet. People have been able to get jobs even with a CPCA. All that depends on is how your resume looks. And you can have 0 experience and no background at all in medical and still get a job with a CPCA in any of these 4 credentials, okay? Any one of these. But again, it's all about how you're relaying your skill. If you're not telling them that you were trained in ICD-10-CM, which is the diagnosis coding, CPT, the procedure coding for outpatient, ICD-10-PCS, that's the inpatient procedures, HCPCS. If you're not, and HCPCS is the durable medical equipment and other procedures for certain government programs. So all of those things are very important to coders to know. But sometimes as brand new people, we think, okay, well, I don't have experience in that yet. I can't put that on my skills list. Yes, you can, because these are the skills that you have now that you have become a coder. And so you have to tell them because they're never going to assume that you know coding. And so that's the difference between somebody who knows how to write resumes and present themselves well. And I have lots of videos on my channel about writing resumes for brand new medical coders. I give all my tips. And using that has helped people too. They say, oh, Bleu, I was watching your videos and I used your tips for interview. I used your tips for the resume and I got a job with the CPCA or with the CCA or with the CCSP or with the CCS. So people have been able to get jobs because you have to be very concise and right to the point. So that has a lot to do with it. But as far as going college or going to AAPC online, AAPC online is just as fine as if you go to a college setting, because you can't always trust that the instructor is going to be a good instructor. Now, what I will say is this. Oh, thank you so much for the super chat. What I will say about this in terms of like, okay, well, this is the college that we're going to for coding. I went to a trade school that's no longer there. And I was sat in front of a computer and said, here, learn. And so sometimes that's the way that it is with instructors at a school, at a college even. And sometimes the colleges will throw on other classes that you do not need because they need to sell a product too. Okay, so we have this coding program, but we're going to set you up with a computer class and we're going to set you up with all these other classes that you really don't need, because that's not what you're going to be going into work for, right? You are going to be going in for the coding. And so some instructors are good, but sometimes they're a dime a dozen, because sometimes, anybody ever heard the expression, those who can't do, teach? And so there's some truth to this. Although I will say that not every instructor is bad. Okay. Not every instructor is bad. And I'm not saying that. There are plenty of really good and awesome instructors out there that I have met personally, and I think that they're fantastic. But again, for a lot of these schools, it's just, hey, we can pay you to just basically proctor from a book. And they say, okay, well, yeah, you have access to an instructor. And then they try to email the instructor because they say you can email anytime and they'll get back to you. And it takes them weeks to get back to them because sometimes they have hundreds of students. Because again, the colleges are a business and they're trying to sell the program. If you actually told people, because I believe that medical coding is a wonderful field, no matter what your age is or what stage you are in life, from just fresh out of high school to just fresh out of retirement, you want to go back to the workforce, any age in between, and you want to get started again in coding, this is a great field because of the simple fact that it's never the same. It does not get dull and boring. There's always opportunity out there for those that want to learn. So if you are willing to do that, you can study on your own. AAPC has an instructor-led course, and they also have a self-study course that you go through by yourself. I have heard it both ways. I am not affiliated with AAPC in any way, but I do talk about them because they are one of the most recognized next to AHIMA in the industry. And these are the two that employers are looking for. The association credential holders from these two associations, they're looking for these two. So that's why I say when it comes to AAPC, I will talk about them, but I will say that there's all these other credentials that they have, but there's a lot of those subspecialty credentials like the CRC, which is the Certified Risk Adjustment Coder. That's diagnosis coding, right? For gathering and collecting data. It's a whole long thing. But it's diagnosis coding. Well, guess what they test you on in the CPC exam? Diagnosis coding. They have CPB, Certified Professional Biller. Well, what do they test you on in the CPC? Reimbursement. Okay. They have the Certified Outpatient Coder, the COC. What is the CPC exam? It's an outpatient coding exam. And the COC just has a few more questions about billing. You know, and so they have all the subspecialties. But when you look at the subspecialties for like, for OBGYN coder, emergency department coder, are the employers looking for these specialty credentials? More times than not, no. They're just looking for one of these four. Now, everyone else, not you, bestie, but I'm talking to everybody else. If you got offended by what I just said, that all of these other credentials are basically rolled into the CPC, if you got offended, there is nothing that I can do about how you feel about something that I just said. Okay? Nothing that I can do about that. You can take what I say any way that you want to. But what I will say is this, in defense of myself. What I tell you guys, it comes from right here. And I got nothing to sell you as far as like programs and credentials and all these other things. There's a lot of that out there. It's a business. This is a multi-million-dollar business. Guaranteed, right? Multi-million-dollar business. Health information is. And I am one of those ones that I'm going to tell you, this is the truth, this, and this, and this. Do I have services? Absolutely. Do I have a Patreon? Absolutely. But that's not why the message and the drive of the show. The message and the drive of the show is it not to see you all make mistakes as far as like racking up a whole conga line of credentials or getting the wrong credential that no one is looking for. Okay? I don't want y'all to make those mistakes. If you want to get additional credentials later when you've had experience, that makes sense. But if you're strolling in and you got a CPCA and then you got a whole conga line of credentials after your name because you think it's going to help you to get in the door faster and find a job quicker, no. Because if that employer, if that hiring manager is anything like me, I see somebody like that with a whole conga line of credentials after name, that's not the person I want. This was a person that takes tests. That's what they do. They take a test, they're trying to make themselves look impressive. No, you can be just as impressive having one certification. And this saves you money. This is the thing that it blows my mind. I'm trying to save people money and they get mad at me. You don't know what you're talking about. No, 16 years, I know a thing or two. Okay, I've dealt with the I've dealt with the pushiness of, oh, you should get an AAPC credential, because in my facility I'm one of about a handful. I think there's maybe 4 of us that are certified with a HEMA. There's only 2 of us that hold a CCS. Me and one other fella, and that's it. So, people told me for years, oh, Blue, don't you want to be like us? And I said, well, what do you mean? They go, we all have CPCs. Well, great for you. But, I mean, my credential, I had the CCA at the time, my credential says I can code for inpatient or outpatient. I could go anywhere. You all are, you're here in outpatient. I can go inpatient or I can go outpatient. This means I have flexibility to go anywhere. And that makes me look more attractive to other employers. So that's why I say I don't want y'all to make that mistake. There's a lot of people that say, oh, you have to get this, you have to get that, you have to get multiple credentials. When you look at the job listings, is it asking you to have multiple credentials? And they say, well, it says the CRC is preferred. Preferred does not mean required. And it will also say, oh, if you have a CCS, CCA, CCSP, or CPC, that's great. You just have to know diagnosis coding, because that's all being a risk adjustment coder is just diagnosis coding. You should know pathophysiology, but a lot of people don't talk about that. And that's the disease, the study of the disease. You should know how to do that. If you're not good with that, trust me, you're missing out on a lot of stuff. But again, I want you guys to understand that I'm going to tell y'all very direct, and that's what I do. So there's a lot of people that they're just so used to people being so concerned with their feelings and how they feel. I don't want to hurt your feelings. I'm not trying to. But at the same time, I want to make sure that y'all understand that I'm going to stop you. And I'm going to try to say, hey, before you do this, listen to what I have to say. Because I've made some people very upset. And they get so upset with me that they send me nasty messages. But then I've had a few come back and say, you know what, Blue? I didn't want to hear it, but you were right. Because in the first year, I would love to have a lot of my money. If I'm working as a coder, this is my first job as a coder, I want to have my money. I don't want to be concerned with having 4 different credentials, having to get specific CEUs that vendor can charge whatever it is that they want to. And I don't want to be concerned with having to report all these CEUs and 36 just for one. And then as you add on more, it goes up and up and up with APC. And then having to report all these with a HEMA. If you have the CCS, the CCA, or the CCSP, you have one of these, it's 20 CEUs for one, because the American Health Information Management Association is a nonprofit organization. Everything goes back into the industry, right? And so that's the thing, there's a difference there. And not to say that you're not getting CEUs with your membership with AAPC, you certainly are, because you do have to pay for that membership. But again, there are certain ones that are not covered, like those specialty CEUs. And if you don't know what you're doing, you shouldn't have that credential, namely the CPMA. Because I've had a bunch of people with CPCAs come to me, oh, my teacher said I had to get it. Why? If you've never been audited, what do you know about auditing? Just say, But yes, that is the difference there. So, Bessie, to get back to your point, you can self-study, totally. You can learn this from a book. You put in 20 hours per week, and I got plenty of videos. Trust me about that one. You can go with the instructor-led, but you may as well be on your own sometimes. So, I mean, you may get lucky, and you may have a fantastic instructor, and by all means, you got blessed on that one. That would be great and wonderful. But if you get stuck, you can always try to find a mentor. A mentor will help you for free. There's a lot of them on LinkedIn. A lot of them are happy to help you. And then there's tutors that if you get stuck and you need help, you may have to pay a few dollars, but there's tutors out there as well. So you can totally do this, and you give yourself a good amount of time to study. If you go through their program, I think it's 8 months, but it doesn't necessarily mean you have to take the test at the end of the 8 months. You can take another couple of months to study and work on your speed. You need to make sure that you're putting in that time, practicing the coding. Then when you're ready, you can take your medical coding certification, then you can get out there and you can start looking for a job. Make sure that your resume is in line. But other than that, that's the thing that you want to do. And again, there's plenty of resources on my channel talking about the resume tips and what to add and what to do and where to apply. And like I say, don't look for those entry level words. Make sure that you are doing your due diligence about that organization, and that you're getting out there and you're being proactive, because it may take a few hundred resumes, but it really all goes back to the quality of the resume too. Sometimes if you have more than one page resume, you're going to be looking for a while. It has to be one page resume, one page cover letter. Cover letter is your human draw. It is what you are, what can you bring to this organization. That's where you list your soft skills, that you're a team player and that you're organized. You never put that on your resume. Because to me, oh no, that would be the first resume I was like, because you need to have your hard skills, which is your diagnosis and, all those ones I said earlier. You got to have those on there because that's what they're looking for. And it's in the job listing too, So, all right. So hopefully that answers your question. Alexandria says, awesome, Misty. I got the new Optum books during the sale Bleu told us about. Yay! And thanks for the super chat, bestie. I appreciate you. Let's see. Where did it go? Okay. Can we just take the coding, or is it best to also take the billing in the program? You have to take the billing in the program, because even though you're not going to be a biller and you just want to be a coder, you're still going to be tested on reimbursement in the exam. So that's one of the domains of the test is reimbursement. So basically you have to understand the basics of these reimbursement methodologies and things like that for the outpatient side. And it goes into a lot of those things, but yes, you still do have to take that. It's just not necessary to take the whole specific billing course. That reimbursement is going to be included in that CPC course. So, Princess says, finally caught alive. Hi, Blue. Hi. Amanda says, hey, Blue, I started my new job as a medical coder and biller on Monday. Yay! Congratulations. That's awesome. Liz says, as an introvert, I do need to work on my communication and interview skills. I do great with one-on-one interviews, but panel interviews make me nervous. So if you have this problem that it's a panel interview. So a panel interview, if you don't know, for medical coding, usually involves the coding supervisor, maybe the coding lead, maybe a doctor or the physician champion. Somebody from the billing department is also in there. So maybe it's 3 or sometimes it's 5. They do this to kind of knock you off your game too, because if you're only going in with 2 people, some people can handle that. You get into 5 people, and sometimes it makes the candidate nervous. They want to see how you perform under pressure. That's that test. And even though this is a very subtle test, this is a very okay, how are they going to handle this? Because if you go in there, oh my gosh, I'm so nervous, and then you can't perform as far as answer the questions, you get deer in the headlights, and you can't do anything, you freeze. This is not the person that they're going to hire, unfortunately. And so you want to make sure that even though you're an introvert, believe it or not, I'm an introvert person too. I'm a very shy person. But when it comes to coding, oh, that shyness goes right out the door. And I am willing to talk and go on and, and be with the people. But that's something that you have to practice on. And then you can find ways to practice in subtle ways. If you go to the church, you can talk to more of the parishioners. If you don't go to church, it's okay. When you're out shopping and you go to the cash register lady or the cash register dude, then you can talk to them and say, hello, how's your day? Make eye contact. And that's something that you can work on. This is a person that is just doing their job in the service industry. And that's something that you can do. You can connect with that person. And that's getting in practice. Okay. I see that a lot with a lot of young people, that they don't look at you. They just kind of look at the ground, and they're not very they don't conversate with you or anything like that, because they're right there on their phones, you know. And so getting away from that and making sure that you exercise that skill or build it up if you need to, that's going to be a lot better for you. Sometimes if you have something in your hand, that does help. Not like you're going like this, but just something that you can hold. And if you can keep this item still, this is something that's drawing out that energy. This is drawing out your energy, because you may be like, oh my gosh, I'm so incredibly nervous. But who's feeling this nervousness? This pen, right? So if you're talking and you happen to say, well, you know, in this instance, this and this and this, and they may think, okay, well, she's just holding a pen. Meanwhile, inside you're like, oh my gosh, I'm so nervous, but this pen is staying still, so I know I'm okay. I know I'm okay. I can kind of be with the group, but I can also make sure that I'm not so jittery. I am focused on this pen, but I'm not staring at the pen, but I'm just using it as a way of connecting with my audience. It's just something that I can hold in my hand. Okay. And when I need to pause, I can pause like this and I can continue on. And then after a while, you won't need something like this. This is only if you feel like that. But the more practice that we can get talking and saying hello and being around other people and in groups, in small groups, the better off you'll be. But that's going to take practice. And that is a, gosh, what is it? It is a, gosh, there's a word I want. There's an effort that's got to be put in to that, because otherwise it doesn't work. The only one who knows that you're struggling with this is you. Because trust me, people won't know that you're nervous unless you start showing it. Because when I was giving my speech at the HEMA conference last year, at first I was a little nervous. I was like, oh my gosh, this whole room is filled with people. But then when I got up there, of course, that goes away and I'm able to, you know, give the conversation and do the presentation, things like that. But at first I was like, oh my gosh. And I tell myself, okay, this is what I'm here for. And then I get excited about it because I know that all of these people are here to see me speak, which is even more awesome. You know, it's an awesome feeling. And it's an honor really to have people come and watch you speak. And they say that this is why they wanted to come here. So that was really awesome to get that. And then have that feedback after the conference was really awesome too, because I had a whole line of people waiting to come over and say hello. So that was a lot of like one-on-ones, but practice that eye contact. And even if it is that you have to start with the mirror, that's something basic. You could start with the mirror, look at yourself in the mirror, in the eyes, hold it 5 seconds, and then kind of look away and then go back to yourself and your eyes. Then when you're speaking to somebody, do the same thing. Start with somebody that you feel comfortable with. Then go on to somebody that's in the service industry. Then go on to maybe somebody at your church, or if you're not in the church, just wherever you have other people where you gather with and that kind of thing. Or if you see people in the morning when you're walking into the store or whatever, say good morning, hello, you know, like to the cashier or something like that. You know, don't be running around saying hi to everybody because that just looks weird. But, you know, there's people that do that all the time. But like I say, if you do that, that way it'll help you to get that practice in and look for those ways of practicing. And then after a while, it'll be like nothing. At least that's just my advice anyway. All right. Sunny says, I need to finish a few more sessions in my college course and then begin studying for the exam. Okay, good. Letty says, don't forget to thumbs up. Thank you so much, Letty. Gail says, I have my CCA, a HEMA, doing half of the RHIT program. I'm working full-time in a mental health hospital as a coding specialist over a year next. What would you recommend next? Well, depending on what you want to do, Gail, I mean, if you want to continue on in behavioral health or mental health, then make sure that you're studying up on all of those things and, you know, get sharper with the different types of conditions. So that way you can become a subject matter expert in that particular specialty. And then as you feel more comfortable, then you should volunteer to do speaking engagements. You know, if you really enjoy it, that's what you like to do, start volunteering to do those things with the HEMA, because they could certainly use you, you know. And if you want to talk about your specialty, trust me, the local your state local component association chapters, oh, they would love to have you. So that's the thing, you know. Next week I am speaking for the Rio Grande Valley Health Information Management Association, and they've invited me to speak. I'm going to be the last speaker of the day on the 31st of January. It's virtual and it's in person. So if you're not able to make it down to Westlaco, Texas, that's okay. You can attend virtually. It is $40 and you get 7 CEUs. It is a whole day that you can be listening and virtually seeing these conferences or these speakers speak. I am speaking the last. I close out the whole day. I speak at 3 o'clock. And I'm going to be speaking on improving your skills as a medical coder, auditor, and health information professional. So I have left the link, but I'm going to leave the link again. So if you're interested, they do take checks. They do take Zelle, and they take Cash App. So if you're interested in attending and getting CEUs, if you already have your certification, that's great. That's a great way to get a bunch of CEUs. So I'm just saying, but I think it's an awesome experience. It's going to be my first time speaking for a local chapter, and especially for the Rio Grande Valley. I have done speaking engagements before for AAPC. I won't do them anymore, but I will do them for AHIMA. So just so you guys know. But yes, I'm speaking then. But that's something that you can do if you are interested in that. And maybe you might not think, oh, I don't really want to do that. That's not something I'm interested in. Try it. Try it, because you never know. You may be so excited about it later on. You may not be excited at first, but it's something that could open doors to giving you exposure to things that you may not have thought would be interesting for you. If you would have asked me when I first got into this, oh, Blue, do you think you want to be an educator? I would have been like, are you out of your mind? No, you know. But then being in it, I was like, of course, 6 years in 2014, I'm like, oh, now I get it. Now I get it. And I enjoy teaching. And then, of course, 2018 is when Medical Coding with Bleu started. So that's when it really, you know, got, okay, this is awesome. So maybe that might be something you might like to get into. Just a thought. Misty says, right, AAPC wanted to charge $30,000 for an instructor-led course. Oops. I only bought the books. Jeepster says, I previously worked in claims examiner, and I'm currently a claims auditor. Nice. If I pass my CPC, can my previous experience be used to waive the CPC designation? You have to get with AAPC, but I think because of that, like, you have to deny the claims, at least that's what I think. And you have to say why. That's using your book and using your knowledge. So absolutely, that's coding knowledge right there. So I would absolutely say that. I would get with AAPC to find out what the requirements are. I know they have to have a letter from the employer on the letterhead and everything. It's got to say specific things. But yeah, get with your employer about that. Get with AAPC and find out what you need exactly. But yeah, I would think that would count. But ask them, okay? Nicole says, should I purchase the 2025 coding books because I still have been completing my coursework using the 2024? Yes, if you are taking your exam later in the year, I don't know which exam you're taking, but if you're taking it after, if you're taking an AHIMA exam beginning May 1st, you will have to be in the 2025 editions. If you're with AAPC, you could use the 2024 editions all through this year if you wanted to. However, if anything in the exam updated, because AAPC updates their exams January 1 and to the 2025 codes. And so if anything has updated and it's not in your 2024 books, you kind of take a chance there. So it's entirely up to you, and I don't know which one you are taking, but that would be my advice. I would say go ahead and get the 2025 editions. Optum is your best bet for those. I'm just saying. Thanks, bestie. Shandas says, I'm in school now for coding because I don't have to pay anything out of pocket. Oh, cool. So there's also, just so you guys know, there's the WIOA program. If you are in a minimum wage paying job, if you have been laid off from your job, or if you've been displaced because maybe you're out in California and you were affected by the fires and you no longer have a job, there's money and funds in the Workforce Innovation and Opportunity Act. That was who I went through to get my schooling paid for. Although back then it was a WIA, it was called WIA. Now it's called WIOA, the Workforce Innovation and Opportunity Act. You can Google this. You can go to your local workforce office and you can ask them about that program, or you can Google and see where the nearest location is that they can talk to you about it and see if you qualify. But if you are low wage paying, like minimum wage job, or if you've been displaced, you've been laid off, you're unemployed, you could potentially qualify for some of those funds. And if you do, and they have like a list of these programs, and these are the only programs that they use, find the best one of the bunch, even though maybe it's not what you really wanted, but find the best one of the bunch and then do it that way, because I only had to pay for half of my exam. They paid for the other half. So that was it. But that the requirements at the time were you get a job in the field that you were trained, complete the program, get certified, and find a job in the field you were trained. My case manager, when I went through this, because I was unemployed, and he said there was all these listings of all these jobs that they can train you for, like trucker or beautician or medical coder, medical assistant. And I said, oh, well, I want to do accounting, because they had accounting, because I like numbers. I'm a numbers person. And so he said, well, what about medical coding? I said, oh, no, I don't work with needles, because I know everything, right? And he said, no, he goes, it's not needles. It's you're reading documentation and you're putting like the diagnosis and the procedures into codes for the insurance and for statistical purposes. And so I was like, that sounds interesting. I was like, okay. And he's like, it pays well. The field's always growing, and you'll always have a job. So I was like, okay. And he goes, check out 3 schools, and if you don't like what they say, come on back over here and we'll get you in the accounting program. So I said, okay. So I went to the first school. Of course, they're trying to sell a fast-paced medical coding program. They say, oh, this all this money. And I'm like, this sounds like a scam. The second one I went to, the guy says, so he writes out this big old long word. And of course it was EGD. And I'm like, oh yeah, that's EGD. And I was telling him what it was. He said, okay, well, what about this word? And it was something with the heart and things like that. And he's like, are you a nurse? And I said, no. And he said, how do you know all these medical terms? I go, well, I know this prefix means this, and this suffix means this, and this root word means this. I mean, I'm a reader. That's what I do. He's like, wow, I think you'd be great in this program. But again, they were selling the dream. They were selling, oh, we're high paying salary and blah, blah, blah. And so I was like, okay, one more school. He said, well, I hope you come over here and get your certification with us. And I was like, okay, well, I got to go one more school. So then finally, I go to this last school, and the lady was like, what do you know about coding? I said, absolutely nothing. And I said, I didn't even know this field existed. So she goes, okay, well, let me break it down to you. So she starts telling me about AHEMA. She starts telling me about APC. She starts telling me about all the things in the program. She said, it's self-paced. You can go as fast as you want to. If you're able to finish it sooner, then you're going to be out there sooner looking for a job. We do have an instructor that comes in who gives you lectures and things. You can attend it if you want to. If you don't want to, that's okay too. But this is all on you. And so I was like, okay. And I was like, I just liked the setup. I liked the way that it was. I didn't know about the creepy instructor at the time, but I knew that this was the place I wanted to go. So I ended up picking that school, and I ended up getting my CCA. And I got my first job 2 months later through the temp agency. And that was all she wrote. So, but yeah. All right. So, okay, military benefits. Okay, that's cool too. The MyCAA program pays for it too. Nicole, do anyone know if I should update my coding books, or should I continue to use the 2024 books? That's a good point, because That happened to me when I had my medical billing license certification. Sapphire, going for the CCS over the CPC. I see more job postings in my area with this preference. Yep. That's because you know inpatient and outpatient coding, and that's the gold standard of medical coding credentials at CCS. Bessie says, Miss B, thank you so much for the good advice. I've been thinking about this for years, and I'm a surgical technologist and ready to change careers. You would be perfect. I have done and met with so many surgical techs that have gone from surgical tech to coder, and they love it. So yeah, this would be totally awesome for you. Let's see. Delta says, how should a new coder deal with the metrics and quotas versus trying to learn and be accurate? Well, that's going to take some self-study. So sometimes in the beginning, right, when they're like, you got to hurry up and you got to hit the ground running, and typically you get a ramp up period where you're going to build up your time and your skill. They don't expect you to, like, if their quota is, 90 per day, they don't expect you to hit 90 on the first day. You're brand new and you're still learning everything. So typically they give you 90 days. Sometimes it's less than that. Sometimes it's 60 days. But if you're going slow in the beginning, that's understandable, because it's always going to be accuracy over productivity. However, if you are remaining slow, not showing any improvement, that's a problem. That's when it's just like, okay, why aren't you speeding up? Because if you're still coding the same amount and it's 3 months later and you're still barely able to make it like 5 during the day, no, something's wrong there. You're going too slow. You're either overthinking, or you're just milking the clock. And it's basically what it looks like. So just make sure that if you're trying to balance between, just take a deep breath. You know that they're not going to let you go right out of the gate. The reason that they would let you go is if you're not meeting accuracy. Accuracy is most important. Some encounters are going to take a little bit longer to go through. Some are going to be faster. It really all depends. So if you are coding and you say, okay, this is going to take me a little bit longer, you know that the next one may be a little bit easier. So you may be able to get through it a little quicker. And then you go to another one and it's just as quick. Okay, cool. This is awesome. I can get through these pretty quickly. Then you hit one that you're going to be slowed down again. You do need to spend time on your own at home studying and practicing with the workbook. Any workbook you get, just start practicing looking up codes. Even though you're using an encoder at work, an encoder is an electronic code book, but you still need to be working with your books at home and getting that practice in. Listening or reading the guidelines, the coding guidelines, that'll help you too, because then if you're coding for sepsis, then you'll know, okay, here's the rules for sepsis. And I remember this about coding for sepsis. If I'm coding for injuries, I know this is going to be for initial, this is going to be for subsequent, this is for sequela, and all of these things. So if I'm coding for mother baby, I know that this is going to be for the obstetric codes. So those are the things that you need to do. Whatever your specialty is that you're working in, you need to be reading and going over practices for that particular specialty. So that way it's not so confusing for you when you're in the job during the day. Okay. You will build up your speed. And especially if you're showing improvement every single day, you're showing improvement, then you're going to be just fine. That's how you balance it. But hands down, sometimes there's going to be days where your productivity is not going to meet, but it's the average. So some days you're going to be able to meet more because it's a little bit easier, or the documentation is a lot clearer and you can go through it a lot quicker. But again, it takes you doing practice at home outside of work. I'm just saying. At least that's my advice anyway. Julia says, hi, Blue. What are your thoughts about seasonal or contract jobs? I mean, if it pays, go for it. You get practice. That's awesome. Dorothy says, congratulations. Nemesis says, I've just got my CPC in December and I feel a little lost right now. I've been applying for coding jobs and haven't had any luck. I feel like they expect you to have so much more coding experience. This is why I say that it's important for you to make sure that if you're applying right now and you're a brand new coder and you don't have experience, Everything on your resume needs to be reflecting all of your transferable skills. You need to have your one-page resume. And if you have not checked out my videos about the tips for resume tips for brand new medical coders, you need to check it out, okay? Because having a terrible resume is the reason that you're not getting called. And even though they're asking for 3 to 5 years experience, you have permission to ignore that part and still apply anyway. Do not apply for only entry level positions, because everything that you get into, you're going to be entry level anyway. Okay. So just make sure you ignore that. If it's for a coding position, go ahead and apply, because if there are happy coders in that area, they are not going to go anywhere. And so that employer is going to be basically at the mercy of whoever's applying. And as my Uncle Kyle says, a closed mouth does not get fed. If you do not tell them who you are, they will not know you. Apply anyway. If you are applying online and it automatically rejects you because the ATS reader does not see that you have the skills, maybe on your resume you have ICD-10 and then nothing else, I would reject you too, because what is ICD-10? ICD-10-CM or ICD-10-PCS. If you have both of these, if you know both of these, then you are going to write ICD-10-CM on one line, and on the next line you're going to write ICD-10-PCS. If you write ICD-10-CM/PCS, guess what? The ATS reader is so dumb because it is only looking for what a human has put into it. They will not put ICD-10-CM/PCS because what the heck is that? That book does not exist. So make sure that you're being very detailed and very complete and thorough. ICD-10-CM, ICD-10-PCS. Okay, so I know you have to have at least ICD-10-CM. If you don't have ICD-10-PCS, that's okay. CPT, HCPCS, all of those need to be there. And you can go through my videos to check for those resume tips. But that's what I would recommend. And you still continue to apply. Even if you think that you're not going to get the job, that they want 3,000 years of experience, you still apply anyway. Because having that barrier right there of saying, oh, well, it's because they said they want 3 to 5 years experience, then you're never going to get in, right? Because you're just going to be looking forever. Apply. My advice anyway. Asking for a friend says, yes, I spoke with a gentleman at AAPC and he was very invested in my coding success. Of course. Until I informed him that I would not go ahead with the school packages, and he offered me, they were all about the sales. Of course, because he wants you to get a fantastic deal. You're welcome, Nicole. Asking for a friend. While I respect APC, I do too, I do get a sales vibe from them. Princess says, Blue, what about the CPMA from AAPC after obtaining the CPC? No, that's my opinion. Is it worth it or not needed? Certified Professional Medical Auditor. If you do not have experience being audited or auditing, you should not get the CPMA. If you are within your first 2 years of having a CPC, you should not get the CPMA. If you do not want to be an auditor or a lead or any of those things, do not get the CPMA. The CPMA requires you, this is, guys, again, you can get it if you want to, but what I'm saying is this: if you get this CPMA, it will require you to get specialty CEUs in order to maintain it. These specialty CEUs are not the free CEUs. These are the specialty CEUs that come from specific vendors that will charge whatever they want to. Okay? Unless you want to get a job that requires it, why are you getting it? Because you're trying to keep up with the Joneses? Because whatever anybody else spends, that's their money to spend. It's not your money to spend. Don't try to do things to be impressive to others. The way that you can be impressive to others is with your knowledge. Not with a conga line of credentials. It doesn't matter, right? Because people can have a conga line of credentials behind their name. Doesn't mean a hill of beans. Doesn't mean they know, right? But I'm just saying that if you are not going into those types of positions, it's really, what is the point of you getting it? Okay? And I always tell the people that are brand new, if you're within 2 years, do not get additional credentials. It doesn't necessarily have to be the CPMA. It could be the CPB, CRC, any of these other ones. Don't get anything else for the first 2 years. Just get one. That's all you need. Because you need to learn how to get your CEUs. You need to learn how to get all of that continuing education so that you can, figure out what it is that you want to do. But don't get things and don't add on things that is going to make you have to spend more money unnecessarily. It's like people who get the degrees because they think they can make more money as a medical coder. No, because the degrees are for our leaders. And if you look at the syllabus for the degree programs, you'll see that it's all about data analytics, the law, medical ethics, medical law and ethics, and that kind of thing. So, and then HR activities. That's what those things are for. Guys, you have to look at what these things are. And don't just take a salesperson's word for it, okay? They are a business. You can't fault them for being a business. You can't fault them for wanting to give you all of these things that, hey, we have all of these things to sell. I've said it before. They are fantastic at marketing. That company is fantastic at marketing. But I will say that, again, you have to be selective because this field gets very expensive. It's all about credential maintenance and maintaining your membership, okay? Because you got to pay that $222 membership every single year. And the more credentials you get, the more CEUs you have to get. The more CEUs you have to get, the more money you got to put out. And then again, if one of them is like the CPMA requiring specific CEUs from certain vendors, I'm just saying, okay? Again, all my opinion. You're free to do whatever it is you want to do, but I'm just saying that you can be a successful medical coder with one certification. I know because I did it for 13 years. I have 2 credentials now. I have the gold standard of medical coding credentials, the CCS, and I have the CCSP. And I had the CCSP because I got that one first. Then I got the CCS the same year. So this is my advice anyway. You're welcome, Nemesis. Bestie says, after completing the program or course, what is the recommendation to take on focusing on a specialty like derm or cosmetics? So with your credential, like you get just say for example, you get the CPC, right? And you have a CPCA. You've been tested on dermatology, right? They have the integumentary system that's part of the domains, right? Because they have all of the sections of the CPT book broken down in there. So you've already been tested on that. So you don't have to necessarily get that specialty certification for dermatology, or if they have it as integumentary, dermatology, plastics or anything, you don't have to get certified specialty for that. Because again, it's already been tested on your credential. All you have to do is just apply at those places so that you can get experience. The best thing that you can do is, if you want to get into dermatology coding, is that you make sure that you're studying that and you know all about the skin and the disease process of the skin and all of the conditions that a person can have that can affect the skin. Like diabetes can affect the skin and make it more sensitive, and that's how people get foot ulcers and that kind of thing. That has more to do with podiatry, but it still is part of the skin family. That's the thing that you got to know there. So knowing the disease process is better. It's good to have that, even though you just have the one certification. Because trust me, that's all you need. It's just the one. Okay. Delta says, thank you for the relatable advice. It gives me hope. This field is exciting but challenging as well, and that's what makes it fun. Same thing, Nemesis, the same thing. Certification, documentation, expert, outpatient, same thing. When it comes to the CDI credentials, because that's a CDI credential. So there's ACTIS has theirs, the Association for Clinical Documentation Integrity Specialists, right? ACTIS. And they have merged with the HEMA, but they have their CCDS and CCDSO. These two are considered the gold standard of CDI credentials. Then there's the CDIP, which is a HEMA's version of the CDI credential, because that's a clinical documentation improvement practitioner, right? Or clinical documentation integrity practitioner, maybe it is. Yeah, that's that one. And then, of course, there's this CDEO, right? Clinical Certified Documentation Expert Outpatient. Again, that's fairly new. I know because one of the people that was sitting on the board for that was talking about how new it was, and how when it comes to what the employers are looking for, when it comes to them looking for a CDI certified, certified in CDI, they are looking for the CCDS, the CCDSO, or the CDIP. Those are the three that are most commonly asked for. When I have looked in the job listings, because I always look to see like what credentials they're asking for out there, I don't see it a lot. Not to say that it's not asked for, but what I'm saying is I look everywhere. I look in New York, I look in Florida, I look in Texas, I look in Michigan, I look in California. And when I look and I'm looking for CDI jobs, because like, what are they looking for out there? Time and time again, CCDS, CCDSO, or CDIP. So if that's where you want to go, that's into CDI. You might want to consider looking at the CDIP, or if you have a more advanced background, you might want to look at the CCDS or the CCDSO. Now, those two do have some requirements on them as far as like requirements for like experience or education and that kind of thing, I believe. But they do have, it's a higher level, because before, I think for the CCDS, it was you had to be a nurse. The CCDSO, I think you didn't have to. I have to look again, but every time I start looking at those websites, I start looking around. But that's just something that you got to think about. If you're going to add additional credentials, make sure they're asked for, because that could be the difference between a salary bump, and again, because some of these exams are harder than others. The CCDS and the CCDSO are the toughest exams, although people will say that the CDIP is very tough as well. I'm sure that it is. But with the CDEO credential, that is still relatively new. It's only a few years old. When was he talking about it? It was 2019, 2020, he was talking about it. I was hearing about it. So yeah, maybe it's 5 or 6 years old. So it's really not been around that long. But usually when it comes to health information, like the companies, organizations, ACTIS, AHEMA, AAPC, they kind of like, okay, they follow each other. Like, okay, you're doing this, well, we want our own version, right? And so that's what they do. And that's why, like AHEMA, they have now, this hasn't been around long either, but they have their micro credentials. It's just more continuing education. That's all it is, and so again, these things are beneficial if they're asked for. If they're wanted in the industry. For a few years ago, the CRC wasn't as popular as it is now. A few years ago, you didn't even have to be certified to be a risk adjustment coder. That's how far they've gone in the industry. And again, I started the channel in 2018. So back then it was you didn't have to be certified. And then all of a sudden the popularity of the CRC certification exploded, and then people are just, teaching it and then selling the program and that kind of thing. So maybe that's why it got more popular. But again, you could still get the job with the CCS, CCA, CCSP, or the CPC. And they say, oh, well, CRC is preferred. Preferred does not mean required. Preferred just means if you have it, great. If you don't, that's okay too. I'm just saying. You're welcome, Princess. Thank you, Blue. You're appreciated. Appreciate that. Hi, Michelle. Sorry, I'm late. That's okay. But wanted to say hi. We'll definitely watch the replay. Thank you so much. Ambrose says, "Hi, Blue. How do you feel about the CDI apprentice credential? Is that the one from Actis? If it's the one from Actis, that's the best one you can have. The one from Actis is the best one you can have. The CCDS or CCDSO. Okay, I think that's the one you're talking about. That they put the apprentice on it. But that's the best organization for CDI. They were the ones, the leaders of this, because after they did that, then AHIMA did their CDIP certification, and then after that, then AAPC did their CDEO certification. So you have variety, but again, it's all about competitiveness and staying competitive in the market, and that's what they did. So you can't fault them. They're a business. Ambrose says, yes, from Actis. Okay, good. But yes, that is the best. That is the best that you can get as far as CDI. That is the gold standard. And when people are looking for that and you can pass it, that means you know what you're doing, because that is not an easy test to pass either. Hi, Joe. Blue, thanks for the coding content. It helps me stay motivated. Good. I'm glad, because that's why I'm here. To keep y'all motivated. Because sometimes it's not always the easiest thing, especially if you're the only one in your area, or if you're the only one in your friend circle that's doing coding. And then, of course, you hear from people, why are you doing coding? Because it's fun. I could never do that. Well, good thing you're not me, right? I'm just saying. Thoughts on AHIMA possibly switching their CEU rule. Are you talking about the 40% thing, Joe? Are you talking about the 40%? Yep, you're more of a, oh, thank you so much, Princess. I appreciate that. I love that. I love hearing that. That's awesome. It's like I said, it's important to stay motivated, because if you have this goal in mind of becoming a medical coder and you say, well, I hear all these things and all these people from Facebook are saying all these things, which you should stay off of Facebook, because that's the worst place. It's a viper's nest for coders. Just saying. And you're not seeing anything on the bright side, and you say, oh, did I make a mistake? You didn't make a mistake. I truly do believe that coding finds people. Coding finds people. It found me, because I sure as heck didn't know what it was. And it wasn't until I got into it. Like, when I started in coding, I was like, okay, this is a good job. I didn't consider it a career. It wasn't until I was 6 years in and I finally understood. Like, I finally got it, because you're learning. The first 4 years, oh, trust me, you are learning. And then you're like on autopilot those next 2 years. And the timeline is different for everybody. But for me, that was what it was. And in 2014 is, okay, now I get it. This is a career, because I would get so excited, because we were a year out, little over a year out from the implementation of ICD-10 in 2015, because October 1, 2015 was when we got implemented for ICD-10. So when we did, we were practicing and we were getting training and things like that. Well, I was going through 2 programs simultaneously. I was going through one at home for learning ICD-10, and then I was going through one at work. So the one at work, whatever they were missing out on the content, this was a different program, and so it was filling in all the gaps. The one I was going through at home, it was an awesome program. So because of this, I accelerated my knowledge, because I was essentially going through 2 programs at the same time for ICD-10 coding, And so I would get so excited, because I would get off of work, I would come home, and I would start studying. I didn't have the channel back then. I didn't have none of this back then. And I was just like, okay. So I started working on it. And then all of a sudden, when I started getting it, I was like, oh, this is so neat. And so I would get so excited in the morning. I could not wait to get to work to go tell the girls what I had learned. Well, of course, then it becomes competitive. Like, oh, you think you know everything. It's not that I think I know everything. I'm just trying to show you. It's like, this is so neat, And so it was a great learning time. It was a great learning time. And then, of course, we moved in, because we were housed away from our providers. So I didn't know them. I'd never seen them. But I just knew their work online, because looking at their records. Well, then we got to move into this big, beautiful new hospital in 2015, early 2015. And oh no, it was after 2015, 2016, one of the two. We were already in ICD 10. So it had to have been 2016. We moved in, and then all of a sudden, that's when I started meeting with my providers, and then it just added this new facet of learning, and it was this new thing in coding, and I was like, oh, okay. And so they were learning, we were learning, everybody's learning together. So, but it was an awesome experience, and I'll never forget those times. It was awesome to learn, and it was a good, like, okay, now I get it. And you know how they say, if you love what you do, you never work a day in your life? That's when that started happening in 2014. That it was a start, and then in 2016 it's like, yeah. So it was awesome, and I have not worked ever since then. Like, literally. Like, I say this figuratively, but I have not felt like I've worked. This is fun for me. Yes, there are chore things that you do at work, but it's not like, oh my gosh, I gotta go to work. I hate work. I love work. I get excited about coding. And when I get a new provider in and I get to break them in as far as like they've never had exposure to a coder before, they're coming out of residency and I'm their first coder, I think I get to fix them the way that I want to, and I'm the standard for them because I want them that way. That's the best, and then still getting calls from my providers that, hey, I have a question. I love this because that means they still trust me and they still look to me for help. And I want that. I want to keep doing that, so that's what I enjoy anyway. I know, but that's me. Let's see. Joe, you're trying to get me in trouble with this 40%. So, okay. So here's my thing, and some people are going to disagree with me, and I got like about 7 more minutes because I don't want to take this too long. But the 40%, okay, so they changed it back. Now they're going to put it on hold again. Now it's implemented again because it was supposed to implement again in January 1. And now they're saying something else that they're going to put it on hold again. Okay, so here's the deal. What they're saying is that AHIMA requires, if you have one certification, the CCS, the CCA, or the CCSP. This is the medical coding credentials, okay? I'm only going to talk about those because you get into math stuff when you get into the degree designation, because it's 30 for one of those, okay? So when I'm looking at, when they say 40% of the CEUs have to come from AHIMA in order to maintain your credential. Before, they're saying that this was not a requirement. They just said, we need you to come up with 20 CEUs, and as long as they're approved from AHIMA or AAPC, then it's fine. You can report those. You can report AAPC CEUs. We take them. That's fine. Well, AHIMA, it changes. It's a nonprofit organization, but it's still a business, right? It's a nonprofit organization business. And they said, okay, well, we want to require now, and they've been talking about this for a couple of years now, because they were talking about this in Baltimore, right? And when I was at the Baltimore conference, oh my gosh, you should have seen those people. I thought that there was going to be like real on, like loud, like going back and forth, because the people were getting real excited about this, and excited in not a good way. They were saying, look, we have people who are having a hard time meeting those requirements for CEUs because it's too expensive to have to go onto the AHIMA website and to purchase CEUs. Well, the memberships, if you get the membership, it covers the amount of CEUs that you need. Because if you have one medical coding certification, CCS, CCA, CCSP, you need 20. Well, if you get the membership with AHIMA, you get 5 CEUs per year. Right? It's like $149 for the membership, I think. Don't quote me, but I think it's $149. And you get 5 CEUs for the standard membership, right? Per year. You get 5 CEUs included in your membership. Well, if you pay 2-year membership, right, which this encourages you to pay for your membership, then you get 10 CEUs. Well, if the requirement is 8 CEUs, then that means you've gotten well over the 40% required. Now you can get the CEUs, the free CEUs, like that are approved for AHIMA or AAPC CEUs, okay? And so getting them free, I get AAPC CEUs from my employer. and AHIMA takes them. But I also go to a conference, so that helps me. So either you can attend conference, you can pay for the membership and get the CEUs, and it's 40%. That's the 40%, the 8 CEUs, because it's 10 that you get all together included in your membership. This does promote the revenue for AHIMA, which is important for the longevity and livelihood of the organization. Do I think that it's a problem? No. But there's people that will disagree with me because they say, well, Bleu, I can't afford to pay for the membership. I can only afford to pay for the CEUs, like to report them. You can find other CEUs that are from AHIMA products, right? Or you can find other discounted ones and it's totally okay. But I will say this also, guys. This is my opinion and this is how I feel. Do I think that it's bad that AHIMA says, hey, 8 of these have to be from us, or this certain percentage has to be from us? Do I think that that's bad? No, I don't think that that's bad. I don't think 40% is bad because, again, we are represented by them. They still have a lot of work to do. I don't know about all the back scene stuff as far as like the money and where the money goes and all these things like that. But you can look at those figures online. But what I will say is this. Is it reasonable for them to ask for 40% CEUs come directly from them? No, that's not unreasonable. I think it's quite reasonable. It's okay. And I think that they should have done that a long time ago. It could be worse. They could say to us, hey, you have the CCS, CCA, CCSP. AAPC requires their people to have 36 for one, so we're going to do that too. But they're not. So that's what I'm saying. We should be thankful that they're not jacking up our CEU requirement because they could. And that was one of the things the guy over there in Baltimore was saying too. He goes, nurses have a higher requirement for CEUs. AAPC has a higher requirement for CEUs. We could do that, but we didn't. And I have to agree. They could have did it, but they didn't. And then other people will say, okay, well, if you want all of this to come from AHIMA and AHIMA products, right, then give us better offerings so that it could be okay. And they say, well, we want to make sure that the quality, another reason is that they want to make sure that the quality of education that the people are getting is in line with the AHIMA values and education beliefs, which again is reasonable. But again, we also need to meet in the middle, AHIMA. That's what I would say is give us good offerings. They do have some offerings like anatomy, medical terminology courses on there online. You can purchase the programs. It's very expensive. Sometimes it's $29 for one CEU. So it can get costly, but this is the industry that we're in. We are in an educated industry that will require money to continue to grow and to continue to foster all of these things that we can do. So I do think it's reasonable. I don't think it's unreasonable. And I do think that people can find ways of getting the money together to be able to pay for these CEUs if they don't have access to free ones, if they're not, with their employer or anything like that. There's money out there that can be found to pay for these, so it's not unreasonable, I think. And there are low cost CEUs out there, but you just have to find them, there are different places, so that's just what I would say. But I don't think it's unreasonable. And I think that it's fair because again, it could be worse. 40% is not bad. And the 60% is AAPC or whatever you want to do. That's just what I would say. And they say the CEUs from the state components count towards that 40%. So it's not like, you're having to go really way out. Like I said, you can get 7 CEUs from the Rio Grande Valley conference that I'm speaking at for AHIMA. Well, it's the state component chapter. It's for the area. The Rio Grande Valley Health Information Management Association, they have theirs, and it's 7 CEUs for $40. So again, I don't think that that's unreasonable. I think it's fair. I'm just saying. $40 for 7. All you need is 8. Come on. Again, just my advice. So hopefully that answers your question, Joe. Princess says, I'm studying on my lunch now because of you. Good. Trying to get my 20 hours. Yay! You're always in my head. God sent you. Oh, to help me. This channel has truly blessed me. Well, I appreciate that. That's awesome. Joe says, would you happen to have any advice for interdepartmental transfer? I am a trauma registrar 2 years in and would like to transfer to our coding department and use my CCA. Then, as my Uncle Kyle says, and as I've said a couple times already, if a closed mouth does not get fed, you need to go be meeting, shaking hands, talking to the coding manager and say, do you have any openings? I'm interested in transferring over. I've got all of this skill and I've got a CCA. I am proficient in inpatient coding and outpatient coding. So I can be put anywhere and I have no preferences. So you can put me wherever you need me and I'll rise to the task. I'm very interested in transferring my skill over here. What do we have to do? Be very direct. The more direct that you can get, the more confident that you can sound, the more that they will appreciate that. And, and if they don't want you there, if they say, oh, no, we don't have anything, start applying elsewhere. Start putting that skill to use. All that stuff that you did as a trauma registrar, please. That's going to help somewhere. It's all a matter of putting it on a resume, making it look good, and getting out there. And if people reject you or they ghost you, you got to keep applying until you get what you want. I'm just saying. Barbie says, can't wait to meet you in person at RVA. I wish I was going in person. However, I asked, do I have to go? And then she said, oh no, you can do this virtually. So because it was kind of like at the last minute where as far as like I've got other stuff starting in February, I was like, man, I would have loved to go because I haven't been down to the valley in years. I mean, I haven't been to the valley in years, but I always did love Westlaco. There's a restaurant there and I can't think of the name, but my mom and I would always go there whenever we were down there in Westlaco. But it was a little taco hut and oh, it was the best. I mean, like I always say, like if you want really good food, good Tex-Mex food can be found in San Antonio, not Austin. Although they will say that you were the best taco capital of the world. No, y'all are California tacos. There's a difference. Now, they do California tacos. El Paso does Mexico tacos. Like they do burritos. They don't understand taco. They understand burrito. But San Antonio is hands down by far and away the best place for tacos. And then if you want the best tamales in the world, Victoria, Texas. Best place for tamales. No offense to down there in Westlaco, because I know there was a few places down there, but I'm just telling you guys, Victoria is the way to go for that one, and San Antonio is the way to go for tacos. I'm just saying. Dallas is pretty good too. Dallas has some pretty good joints over there too, but not like San Antonio. Best place in the world. I'm just saying. But you will see me on the screen, Barbie. You will see me on the screen, but hopefully, if I get invited next year, I will be down there. I would love to do that. I would love to go in person to do that. So we'll see. But I'm glad you're attending. Joe says, that's awesome. Exactly how I feel with the registrar program. I get super excited reading the code books and learning, wanting everyone to be excited like me, but sadly not everyone is because they don't get it, right? They don't get it. And so, but when they do start to get it, they're just like, oh my gosh, are you like this? Yes, this is fun, Barbie says, hey, Blue, I am a recent HIT grad and excited to start my career. I have knowledge of medical coding, but I feel like I'm not strong enough to apply for jobs. Have cold feet. Well, get on that workbook. And make sure that you start practicing because that's the only way you're going to get rid of that cold feet feeling. If you are practicing and you graduated from the HIT program, so I know you got inpatient as well. If you have the Optum ICD-10 PCS book in the back, there's 388 procedures to look up. Start with one and with number 388, you know, so work through that. Work through the Nelly book, the ICD-10-CM and ICD-10-PCS coding handbook with the answers by Nelly Leon Chizen. Work through that book, and trust me, you will get strong, because that book that book is very good. That's one of the best books for learning diagnosis coding and inpatient procedure coding. And then get yourself the CPC study guide. Any year is fine. Get yourself a cheap version of it. The CPC study guide, even though you have the HIT and even though you're going to get it certified with the HEMA, I'm telling you now, that is written very well, and I will always recommend that book because it's good for coders to learn, and it's very basic and simple. They did a wonderful job writing it. Do I agree with all the codes 100%? No. But for the most part, I do agree, and I do think that they did a wonderful job. So I highly recommend that book too. But practice, practice, practice. All right. Joe says, thank you, Blue. Always keeping it real, of course. Asking for Francis. Blue, do you ever come to Cali? I haven't been to California since well, no, I take that back. Last year I was in California, but I was only in the airport last year when I was in California. But I did go to San Diego when they had a conference there in 2014, which was a blast. It was a freaking blast. They had Casey and the Sunshine Band out there. And then we were out on the Padres field, you know, with our party. They had fireworks for us, and they had the go-go dancers. We had the tie-dye shirts. It was freaking awesome. That was one of the best conferences I have ever been to. That one, and then of course Baltimore, and then I would say New Orleans. Oh, and then I would have to say Miami. Hands down, my most favorite ones. Oh wait, and Chicago. Okay. So Chicago is on the list. I've been to Chicago a couple times, but it's fun, and I stayed at a freaking awesome hotel. So, but I will say that. But really awesome experience I had out there in California, but San Diego, when they had the conference out there, was where I went to. So it was a lot of fun. I'm just saying. Where we go? Thanks for the tips. I do have those books. Good. Start studying. Brandy says, is there a certain format my resume should be able to get the most attention? I have videos about that, Brandy. So go through my videos, because I'm about to wrap this one up, because otherwise I will continue on talking about resumes. But it should be on one page only. And you should have a cover letter. Okay. Please come to California again. Miami is fun. Miami is fun, but it's so expensive. But it was... okay, I have to say this, and then I'm going to wrap it up. So in my previous life, of course, I delivered phone books. But I also was a bartender. So I went to school for bartending and everything, and I was certified TABC and all that good stuff, right? But I never made mojitos, right? I only heard about the recipe, and I was like, okay, you know, this sounds good. But, I mean, of course, this is Texas, and I'm always making margaritas. Okay, no big deal, you know. Martinis, no problem, you know. Cosmos, okay, I can do that too. I make a mean Cosmo, I'm just saying. However, I go down to Miami, and they go, oh yeah, you want to try a mojito? And I'm like, oh, okay, cool. You know, it's like, you know, it's mint and all that. Okay, cool. And then the guy goes, oh, welcome to Miami. And I was like, oh, okay, well, hi. And he goes, what can I get for juice? And I said, can I get a mojito? He goes, I have the best recipe. He was just totally like this too. And I was like, okay, sure, you know. But he's like, can I make it with mango? And I said, yeah, sure, if you want to. Incredible. I was like, oh my gosh, I could not have more than one. Now I am a lightweight, but I'm telling you guys, that one was the equivalent of like 6. I mean, because when I stood up, I was like, man, this is really tasty. It's good. I didn't taste the alcohol. I did not taste the alcohol. I had my little Cuban sandwich and all that good stuff right there. I'm sitting down, I have my drink, and I'm like, oh, okay, cool. It's time to go. Walk back across the street to my hotel. I got up and I was like, whoa. I said, I'm moving and I'm still standing still. So I said, this is a good drink. So I went and I saw, I think his name was Hector. I went and saw him again the next day. He said, "Oh, do you like that drink?" He goes, "Do you want another?" No, I don't want another one. I just want one, you know? And so, but oh, that was awesome. But mojitos, now I can make a mean mojito. Not his mango mojito, but I make the regular mojitos, but oh, so good. So good. I don't drink a lot, but when I do, I'll drink a mojito. I would rather drink a mojito than a margarita. I can make really good margaritas, but I don't like other people's margaritas because other people's margaritas are too sweet. I don't like it when it's too sweet. It can't be too sweet because then that takes away from enjoying the drink. I'm just saying. But anyway, all right. We'll see about going out to California for sure. All right, guys. Thank you so much for being an awesome audience. This has been so much fun, and I have talked nonstop. And this has been a really long live. So, but I will be back for more scheduled shows on Monday. If y'all have any ideas for shows, comment below. Let me know what you want to see. Some of like the more basic ones, like how to get started and that kind of thing. I have plenty of shows about those. But if you have something specific, you know, maybe I might talk about the 40% requirement. We'll see. Because I did a show about that, but I think I need to go into it a little bit more so people can get it, because I think that that's why a lot of people are kind of upset about it, you know, but hopefully we'll see. I don't know. All right, thanks guys, and I'll see y'all next time. Bye.